Hi, my name is Dr. Ankur Phatarpekar. I'm an interventional cardiologist. I fix people's hearts, to be very simple. But my whole aim in life is to prevent heart disease, and that is what I really am passionate about. When you see any cholesterol report, so there's this LDL, VLDL, triglycerides, all these parameters are there, of which the ACC and the European Society of Cardiology, these are the societies of the world which tell you how to go about treating heart disease. LDL cholesterol, which is called as your bad cholesterol, has the maximum risk of having, cardiac issues and cardiac events. So if it's high beyond a limit, then that might be a problem, and that might cause, something called as acute coronary syndrome or a heart attack in a lay language. For a general population, LDL cholesterol, anything more than 100 is a problem. For diabetics, maybe 70. For cardiac issues, it's 50. And for recurrent cardiac events, that means even despite taking medications, doing diet, exercise, if you're getting cardiac events again and again, it's somewhere around 30. The second parameter which we would also look at is triglycerides. And triglycerides is very, being high is very rampant in Indian population, especially in diabetics. Once you achieve your cholesterol goals, which I said, then there's something called as residual cardiac risk. That despite achieving these levels, there are certain other things which you look at, like lipoprotein A, LP(a). And once you achieve these goals, you then look at these subsets, the triglycerides, the LP(a), and then treat the entire cholesterol, and which would reduce the risk of having, cardiac events. So what happens is I see something called as, in doctor language, it would be therapeutic inertia. That means you do your cholesterol reports every year. You see the cholesterol is high every year. Every year make this resolution that I'm going to control my diet and exercise. And despite doing that, you don't get your cholesterol normal the next year. So somewhere or the other, I see somewhere there's inertia to start medication. And it comes from a lot of things. It comes from the society. Would say that if you start this medicine, it will be like a habit for you, which is a very wrong thing. 2, diet and exercise is very good and it has to be done. But it's not, optional that you do diet and exercise, you don't take medication. It is and not or. All the three, the benefit of each of these three has to be, taken in the fullest form. The red flags would be the levels of LDL cholesterol going high, the levels of LP(a) going high, the triglycerides going high. So I have had patients who would just sit on the cholesterol report despite me telling them to take medication. They would take medicines, then after 3 months do the cholesterol report, feel happy for the cholesterol going down, stop the medication. My question to them was, why didn't you then follow up with another report after 3 months and then see that, okay, now my cholesterol was down because of medicines. Now I stopped medicines and now it's gone up. HbA1c is something which tells how much your sugars has been in the last 3 months. What used to happen is people who had diabetes, they would eat less a day prior before doing their fasting and postprandial, and then levels would come normal. But you cannot escape this. Now that's important even in non-diabetics, because there's something called as a pre-diabetic stage, wherein your HbA1c is more than 6.5 is diabetes, 5.8 to 6.4 would be pre-diabetic. That's the stage where you take action and you have a good chance that you might not become a diabetic. So seeing an HbA1c with cholesterol gives you a complete lifestyle picture of this patient. Secondly, you cannot just treat cholesterol if the sugars are high. You have to treat 3 things: hypertension, diabetes, and cholesterol. So all 3 together. So cholesterol cannot be seen in isolation. You have to see all these 3 parameters which are risk factors for having cardiac events and treat them accordingly. I mean, we're scaling high in everything. And unfortunately, we are scaling high even in heart disease and diabetes. So Heart Stroke India, I think, should be a strong India which starts in the young adults. The young adults should be more aware. They should be aware that if I take actions right now, I'm going to do 2 things. One is prevent my heart disease, and also by taking good action, prevent heart disease of my parents. 2, when you get a bad report, please and please take action on it. There's no point in just sitting on the report, right? So the strong India also should be aware that medications are a necessity. And the last thing is, whenever you have heart disease and you have a heart attack, it's very important that you go to the nearest center which does emergency angioplasties. The time is muscle, is what we call in heart. So if you don't do the right thing at the right time, your heart muscle gets damaged. The more time you wait, the heart muscle goes on damaging again and again. That lag period. So we talk in terms of door to balloon times. So when you reach the door of the hospital, how fast do you go and open the balloon, which is very important. That is how I see a health strong India.